AGSC 114, Intro to Pharmacology, Chapter 9, Anti-Infective Drugs. Chapter 9 covers drugs that are used to treat systemic infections, including bacterial, viral, fungal, and yeast infections. Antibiotic drugs. Antibiotic drugs are only effective against bacterial infections. Antibiotics that limit the growth and reproduction of bacteria are known as bacteriostatic drugs, in that they limit the growth and the reproduction of the bacteria. Then the immune system can also do its part in order to kill bacteria. Other antibiotic drugs disrupt cell wall around the bacterium, causing it to die. Those drugs are known as bactericidal antibiotics. So bacteriostatic stop the reproduction of the bacteria, where bactericidal drugs will kill the bacteria. The antibiotic drugs that are covered in this chapter include aminoglycosides, carbapenems, cephalosporins, fluoroquinolones, glycopeptides, lincosamides, macrolides, monobactams, oxolidinones, penicillins, including combination penicillins, sulfonamides, and tetracycline drugs. Starting with the aminoglycosides, these drugs treat gram-positive and gram-negative bacterial infections. They are bactericidal. They kill the bacteria. All aminoglycosides have a black box warning due to the severe side effects and toxicities, including ototoxicity, which can cause damage to the nerves for hearing and balance, and nephrotoxicity, which causes damage to the kidneys. The drug on your drug list from the aminoglycoside class is amikacin, which is known by a brand name of Arikayce. Carbapenems. Carbapenems are similar to penicillins. They have the drug stem of penem, such as iratipenem, which is Invans. And these are in the group of beta-lactam antibiotics. So if you think of these as a cousin to a penicillin, so they'll treat similar infections. These are going to be for more serious infections. They're only given IV. Cephalosporins are given by oral, intramuscular, and intravenous routes. There are 5 generations of cephalosporins. The designation of a generation is relative to the effectiveness of the antibiotic on certain bacteria. First generation cephalosporins are effective against some gram-positive and some gram-negative bacteria, but they are not effective against bacteria that produce a chemical called penicillinase, which is an enzyme that can break down the drug. They're also not as effective against an anaerobic bacteria. Penicillinase is a bacterial enzyme that breaks down the beta-lactam ring, which is part of the chemical structure in the cell wall the chemical structure of the antibiotic, the cephalosporin and the penicillin drugs. Your cephalosporins will have a drug stem of CEF, CEF, or CEPH. A first-generation cephalosporin is Keflex, which is known by the generic name cephalexin. Your second-generation example is cefotetin, which is Cefotin. Third generation cetazidime, which is Fortaz or Tazacef. Fourth generation cefepime, which is known by the brand name of Maxipime. And your fifth generation example is ceftaroline or Telfaro. Now, cephalosporins are also beta-lactam antibiotics. These are the first cousin to penicillins, so there is a potential cross-sensitivity to a penicillin allergy. Generally speaking, about 10% of the population can have a penicillin allergy, and about 10% of those people will have a cross-sensitivity. The next drug, now your textbook's going through these classes in alphabetical order. I probably would have grouped them a little differently. Just another note, going back to the cephalosporins, cephalosporins are bactericidal antibiotics. Your fluoroquinolones, sometimes just referred to as a quinolone, they are going to treat specific infections, respiratory infections most commonly, also some joint infections. Their drug stem is fluoxetine. These drugs do have a black box warning because they can cause tendinitis or rupture to the Achilles tendon. So patients need to be careful when like stepping off a curb that they could roll their ankle. The drugs include ciprofloxacin, which is known by the brand name of Cipro. Very effective against respiratory infections, including anthrax. And then levofloxacin, which is known by the brand name of Levaquin. Now, in both of these instances, I've highlighted the part of the generic name that's matched into the brand name using the green. But with Levaquin, not only do we get part of that levofloxacin, but you've got the quin at the end that identifies its classification as a quinolone. Levaquin is also used for respiratory and sinus infections. Next are glycopeptides. These are effective against gram-positive bacteria, including methicillin-resistant Staph aureus, which is known as MRSA, which is a very serious infection. These are not a first-line treatment drug. They're very potent. They also have serious side effects of ototoxicity and nephrotoxicity. And they're all of the glycopeptides are given by IV, with the exception of vancomycin, which can be given orally. So the drug stem vancin identifies a glycopeptide, so vancomycin it's kind of split that vancin, the van in the center at the end. So this is the exception to that drug stem. It's known by brand names vancomycin or Furvank, and it'll often come pre-made. This is an example of a pre-made antibiotic that we would use in the hospital. Lincosamides are effective against gram-positive bacteria and some other bacterias. The main drug is clindamycin. It's given orally, intramuscularly, or intravenously. It's also available topically, which can be used as a vaginal cream to treat bacterial vaginosis. We also have it in a topical formulation for treating acne. So clindamycin is Cleocin. The acne version would be Cleocin T. Just some notes. Take with lots of water. They tell the patient don't lay down for at least 10 minutes, and it can cause diarrhea. The majority of your antibiotics, diarrhea and GI upset, are common side effects. With killing off or affecting bacteria, it throws the normal body flora out of whack and can cause yeast infections in ladies. Next are the macrolides. Macrolides are generally going to be a bacteriostatic antibiotic, although in high doses it could be bactericidal. Its common drug stem is thromycin, and the drug azithromycin, which is known by Zithromax or Z-Pak, is common. We use macrolides for sinus infections and respiratory infections like bronchitis. If you've ever had a sinus infection, you might have used a Z-Pak where you take a high dose on the first day and you only have to take it for a couple of days. Next are monobactums. These are only effective against aerobic gram-negative bacteria, so specific, pretty serious infections. It's only given intravenously. It can also be administered through inhalation. Caistin is the brand name for the inhalation for lung infections, specifically for patients who have cystic fibrosis. So the drug astronium is Azactum, and again, that inhalation version is Caistin. Now, this is also a beta-lactam antibiotic. So it is, again, kind of a cousin to penicillins and cephalosporins. So we have carbapenems, monobactams, cephalosporins, and penicillins that are all similar to each other. The next group are the oxazolidinones, or sometimes just known as the lindanones. These are effective against gram-positive bacteria on the skin and soft tissue, including MRSA. And that was actually what this class of drug was developed for, was to treat MRSA, because we had kind of run out of antibiotics. So this was the first new class of antibiotics when it came out. These drugs can be given orally or intravenously, and they have the drug zem of Zolid, which we see as part of the classification with that zolidinones. And the first drug is linezolid, which is known by the brand name of Zyvox. And then we come into our penicillins. Penicillin G benzathine is bicillin LA. My slide's kind of messed up here, and it didn't release in the order that I wanted it to. But antibiotics, penicillin antibiotics, lots of different infections. Penicillins have been around since the late 1930s, early 1940s. They were kind of considered to be a magic pill, which also unfortunately resulted in resistance because they were overusing the medication. It's only good on bacterial infections, but people who had colds and things like that, which are caused by viruses, they were throwing penicillin at it. So we began to see resistance very early in the use of penicillins. So penicillin G, benzathine, it's got kind of an anesthetic in it. This is given as an injection into usually the buttocks. The common drug stem for your penicillins is going to be psyllin, all of your penicillins. So penicillin's a drug, but it's also the name of a class. So we have amoxicillin and ampicillin and nafcillin and piperacillin. So there's lots and lots of penicillins. These are all beta-lactam drugs. So your penicillins, your cephalosporins, your carbapenems, and your monobactams are all beta-lactam drugs because they have a similar chemical structure which contains a beta-lactam ring. Now, there are penicillin-resistant bacteria that produce an enzyme called penicillinase. To treat bacterial infections caused by these types of bacteria, we often use combination penicillins. We'll talk about that in just a second. Another formulation of penicillin is penicillin V potassium, sometimes referred to as PenVK because K is the elemental symbol for potassium. This is the oral formulation. So penicillin G is injectable and penicillin V is oral. And then the combinations. So the most common combinations oral is amoxicillin with clavulanate or clavulanic acid, which is known by the brand name of Augmentin. It's augmented. It's got a helper. The clavulanate actually will deactivate penicillinase so the amoxicillin can get to work, because otherwise amoxicillin can be broken down by penicillinase. Now, another combination drug is piperacillin tazobactam, and we see that beta-lactam component. This is known as Zosyn. This is only available as an IV, and here we have a pre-made Zosyn that would be administered in the hospital. The next on the list are sulfonamide antibiotics. These are commonly referred to as sulfa drugs. They have the drug stem of sulfa. These are bacteriostatic. Oh, I'm going to jump back. Your penicillins are bactericidal. So your sulfas are bacteriostatic. They do not kill the bacteria. The body has to come in and take over. One of the most common ones used is sulfomethoxazole with trimethoprim. This is known by the brand name of Bactrim. Other brand names can include Cotrim and Septra. A few things with this. Sometimes we see this abbreviated SMX, because I'm not, let me write it down. Sulfamethoxazole, trimethoprim, TMP. SMX/TMP as the abbreviation. Now, it's a combination drug, so it comes in standard forms. We see here that this says double strength. It's 800 milligrams of sulfamethoxazole with 160 milligrams of trimethoprim. And over here we've got Bactrim, which has 400 milligrams of sulfamethoxazole with 80 milligrams of trimethoprim. So sometimes the doctor will write Bactrim SS for single strength, that would be the 480, and DS for the 800 160, because this is double strength. Tetracyclines are the next ones on the list. Tetracyclines have the drug stem of cyclin. The sample on your worksheet is doxycycline, which is known by the brand name of vibramycin. Now, a few things about tetracyclines important to know, and we see it here on these label, that this drug should not be given to anyone who is pregnant or who might be lactating or breastfeeding. Also, this is not given to children under the age of 9. We also warn the patients, do not take with any antacids, iron, or dairy products, because the drug will bind up with those components and will not be available to treat the infection. And especially with dairy, it will bind with calcium, also in those antacids, and it'll deposit into bones, and it can make them weak, and it can affect teeth as they're being formed. So that's why we don't give it to pregnant women or children, because we don't want them getting this and having it impact the way that their bones and their teeth are forming. Next are antifungal and anti-yeast drugs. Fungus and yeast are single-celled organisms. They're kind of like plants, sort of. We use anti-yeast drugs to treat yeast infections. Those are most commonly a vaginal infection, but they could also be something like candidiasis, which is in the mouth. Anti-yeast and antifungal drugs treat opportunistic infections. So they're very prevalent in patients who have other illnesses. So chlorotrimazole, which I've somehow misspelled here. I'm going to fix that real quick. Okay, so I fixed the spelling. It's clotrimazole. And then miconazole is another common antifungals. These could be topical. Clotrimazole can also be a troche. If someone has trench mouth, they have oral candidiasis, they suck on the troche, kind of like a lozenge, and it applies in the area where the infection occurs. The drug stem for these are azole, or sometimes known as conazole. These are referred to as the azole antifungals. One of the older drugs that we have that's an antifungal is nystatin. It's known as Mycotin. It's also known by the brand name Biostatin, which is listed in your textbook. This drug can be administered orally, it can be administered as an IV, and it can also be administered as an oral suspension. The oral suspension may be swallowed, but most often it's going to be used as a swish and spit. If a patient has sores in their mouth, if they have oral candidiasis, they swish this around in their mouth and then they would spit it out. Next are antiretroviral drugs. An antiretroviral virus, HIV, is a retrovirus. It has a reversal on the way that its genetic code is interpreted and reproduced. When we use antiviral drugs, especially with HIV, the treatment often includes a cocktail therapy where we're using 2 or more antiretroviral agents in combination. We've talked about this a little bit when we talked about the anti-tuberculin drugs. By having that cocktail therapy, it helps to limit the risk of developing resistant strains, specifically here of HIV. So there's actually 8 classes of antiretrovirals that we use in treating HIV and AIDS. So we use protease inhibitors, fusion inhibitors, nucleoside reverse transcriptase inhibitors, nucleotide reverse transcriptase inhibitors, non-nucleoside reverse transcriptase inhibitors, integrase inhibitors, CCR5 antagonists, and cytochrome P450 inhibitors, as well as those combination drugs. Now just breathe for a second, because this list looks overwhelming. I get that. We are mostly going to use the abbreviations for identification because there is a lot of similarity in the words, especially in the 3rd, 4th, and 5th ones that are listed here. But they're all going to impact pretty much the way that the virus will either attach or the way it would replicate. So let's first talk about those protease inhibitors, or the PIs. These are all oral drugs. They bind and block the HIV enzyme protease. So if the enzyme's not there, then the HIV virus cannot reproduce. It remains immature, undeveloped, and it can't be infectious. The drugs in this group have the drug stem of Navir, including atazanavir, which is Reataz. We also have Indinavir, which is known by the brand name of Crixivan. Next are the fusion inhibitors. Fusion inhibitors came around in the mid-2000s. So most your older drugs, your PIs, your NRTIs, your NTRTIs, and your NNRTIs, those came out in the late 80s and very early 90s. The fusion inhibitors were the first kind of new group that came out in the 2000s. These block the virus when it tries to bind with the receptors on the helper T cells, lymphocytes. Because the virus is unable to attach to the CD4 receptor, it never enters into the cell to be able to reproduce. So the thing that's unique about any kind of virus, including retroviruses, is they do not reproduce on their own. Bacteria is its own living organism. Fungus and yeast are their own living organisms, but viruses and retrovirals need a host cell, and they kind of come in and take over and use that cell to do its reproduction. So they have to have a cell to invade to be able to reproduce. So this is going to help prevent the reproduction of the infectious HIV cell. Now, these drugs are given as an injection, and Enfuvirtide is Fusion, and it's given subcutaneously. And I see, when I'm looking at this, I see Fusion and Enfuvirtide, Fusion. They all kind of have that few component to it. Another class are the GP120 attachment inhibitors, or 120 attachment inhibitors. These are also a type of fusion inhibitor. It's more like a subclassification. And we have fostemsavir, which is Rukobia, and this is taken orally. And then we have post-attachment inhibitors, another subgroup of the fusion inhibitors, and that includes the drug evolizumab, which is Trogarzo, which is given by injection. The NRTIs exert a therapeutic effect once the HIV gets inside the T lymphocyte. Inside that lymphocyte, the HIV will use its enzyme reverse transcriptase to change its viral RNA and into viral DNA. This drug is going to have an impact on that infectious agent in doing that. These drugs are taken orally. Zidovudine, which is Retrovir. This was actually the very first HIV drug. Talks about how they did an emergency approval on it to get it to market quicker. We see here on the label that sometimes this was referred to as the AZT. We want to be careful using that because some people use that abbreviation for azithromycin, which is an antibiotic in the macrolide class. So that could be very confusing. But Retrovir, it's a reverse transcriptase. It's a retroviral. So Retrovir for retroviral is where that name comes from. Your NT-RTIs, act similar to the NRTIs. They just have a different molecular structure. A nucleotide is a nucleoside that is chemically linked to a phosphate. So it's just a little chemically different. These are also taken orally. Tenofovir, which is known by the brand name Viread. The NN-RTIs are non-nucleoside reverse transcriptase inhibitors, and they act by binding directly to the reverse transcriptase and keep it from converting that viral RNA to a viral DNA strand. These are also given orally, and the example drug is efavirenz, which is known by the brand name of Sustiva. The integrase inhibitors, these are newer in the scheme of things. These came after the fusion inhibitors. They block the HIV enzyme integrase, which that enzyme enables a viral DNA to integrate or get an integrate or merge with the DNA of a helper T lymphocyte. If we block that, then the two can't merge or combine together. And if that doesn't happen, then the virus can't reproduce. These drugs are given orally, and the example drug is raltegravir, which is known as Icentris. Entecavir is the drug stem associated with the integrase inhibitor. So we've got the tegra part from integrase and the integra, and it's an antiviral or antiretroviral to be correct. Next, we have the CCR5s antagonists. These are blockers. They're going to block the co-receptors and the CD4 receptors and keep HIV from fusing with and entering the lymphocyte. This drug is only used for strains of HIV that can attach to the CCR5 receptor, and this drug is given orally. Miraviroc is the example drug, and the brand name is Cellzentry. I kind of think of this as they're kind of standing sentry to blocking the virus from invading the cell. So it's a cell sentry, Cellzentry. And they're Miraviroc, they're kind of like a rock that's blocking. I know it's not a perfect match, but it's one of those things to help you kind of remember or associate names. And then we have the cytochrome P450 inhibitors. These are the most new of any of them. They repress a specific cytochrome, which is a protein and iron-containing compound, which is important in the energy of the cell. It increases the amount and therapeutic effect of antiretroviral drugs such as atazanavir and darunavir. It doesn't have any direct action on its own, so it has to be taken with other HIV drugs. A lot of our drugs are actually metabolized using the cytochrome P450 enzymatic system, so this is going to stop metabolisms. So it's going to help make those drugs more efficient or effective. And the drug in this group is Bixasat, which is Tybust. And I kind of think of it as it's almost like a boost. They should have added an extra O in there, so it made more sense. But these are taken orally. We see here that these are tablets. And then there are combination drugs for HIV. And that's important. Again, that cocktail therapy. What we use is the term HAART, HAART, It stands for highly active antiretroviral therapy. And the combination is going to be customized based on how much HIV is present, the strain of the virus, the CD4 lymphocyte count, and the patient's symptoms. But some of the common combination drugs include lopinavir with ritonavir, which is known by the brand name of Coletra, and emtricitabine with tenofovir, which is known as Truvada. And the thing about HIV, at one time when someone was diagnosed with HIV, it was pretty much a death sentence. But we have more people living with HIV today. We're preventing them from advancing into that deadly AIDS component. So good health management with medications. You're kind of, if you wanted a poster child, I guess, for living long and living well with HIV would be Magic Johnson. He was diagnosed in the early 1990s. So he's going on about 30 years of living well with HIV. Now, we also know once they can get those CD4 numbers low enough that they're not readable, that the patient no longer can transmit the HIV virus as well. There's a few other things that go along with this. We talk about somebody being exposed, so using pre-exposure prophylaxis for partners of someone who's HIV positive and the partner is not. And then we also have PEP, which is post-exposure prophylaxis for healthcare workers or first responders that potentially get stuck with a needle and they don't know, or they do know that the patient is a known HIV or AIDS patient, to help prevent them from the virus from taking root in their bodies. So there are some options in there. But heart, that's the cocktail therapy. We want highly active antiretroviral therapy. Hit it with some big guns and keep those numbers low. So then we have drugs that we use that are related to HIV and AIDS, mostly in the AIDS component. Patients with HIV, it's human immunodeficiency virus, they have weakened immune systems. They are immunocompromised. Because of that, they have an increased risk of opportunistic infections, things like fungal infections, and they're very prone to pneumonia and other respiratory infections. So we want to kind of boost them up and help them with some of the challenges of having HIV and AIDS. So first off here are drugs for AIDS, for body wasting syndrome, loss of appetite, loss of weight. A lot of the side effects from the drugs make the patients not want to take them, or they cause nausea, so patients don't eat, they can lose weight. So the drugs that we use for wasting syndrome are meant to stimulate the appetite, to help build muscle mass, and to combat the weight loss. So dronabinol, which we talked about in the GI system for nausea and vomiting, is very effective in stimulating appetite. Again, this drug is related to THC. It is a controlled substance, Schedule 3. The capsules are available by the brand name of Marinol, and then it's also available as an oral solution by the brand name of Syndros. Now, in fighting those opportunistic infections such as Candida, so the oral infection, a fungal infection. Hold on one second while I fix that slide. There we go. So a fungal infection. Fungus and yeast, again, are opportunistic, that they can become widespread and serious systemic infections, especially in patients who are immunocompromised, either patients with cancer or have HIV or AIDS. An extensive yeast infection that involves both oral cavity and esophagus, the most common one being candidiasis. And this opportunistic infection is common in patients with AIDS. So the drug is fluconazole. Whoops. I just shifted our screen there. So we have fluconazole, which is known by the brand name of diflucan. So the drug stem is commonly used as voriconazole, or again, that azole antifungal. We also see in patients who are immunocompromised a condition called cytomegalovirus retinitis. So this damages their eyesight. Cytomeglia is a virus, cytomegalovirus, and we would use an antiviral drug. And the antiviral drug used for CMV most commonly is valganciclovir, which is known as Valcite. This drug can be given orally or intravenously, and that's what it looks like. Other opportunistic infections include MAC, so that's Mycobacteria avium intracellular complex. This usually would present in a late stage as a complication in AIDS, and it's treated with aminoglycosides such as amikacin, macrolide antibiotics including azithromycin or clarithromycin, and the anti-tubercular drug rifabutin. So it's a cocktail that we would use to treat this complex. And again, this is going to be later stages complications. Next, we have pneumocystis jirovecii pneumonia. The pneumocystis is actually a fungus, and this is a life-threatening complication of HIVs. So the drug that we use is actually an antifungal, antiprotozoal drug that is specific for treating this type of pneumonia in an AIDS patient. And the drug is known as pentamidine, which is Nubipent or Pentam. The Nubipent is, or Nebupent, is an inhalation solution. A nebulizer is a machine that delivers vaporized medicine to the lungs. So that's where the nebu part comes in. And then Pentam is the injectable formulation. Antiretroviral drugs are used to treat infections that are caused by a virus. Not going to be effective against bacteria or fungus, only viruses. Antiviral drugs, we've already talked about them in chapters 4, 6, and 11. And again, we'll talk about them in chapter 15 as well as in Appendix B. Now we come to more questions.